Normal vaginal discharge versus cervical mucus is a topic that often causes confusion. In this detailed expert guide, we will explore the differences and provide clarity on what constitutes normal and abnormal discharge. Understanding normal vaginal discharge is crucial for maintaining vaginal health. It serves several important functions, including cleaning the vagina, preventing infections, and providing necessary lubrication. Vaginal discharge is a normal physiological secretion that plays a crucial role in maintaining vaginal health by cleaning the vagina, preventing infections, and providing lubrication. It consists of a mixture of cervical mucus, vaginal epithelial cells, secretions from the Skene's and Bartholin's glands, and normal vaginal flora. The characteristics of normal discharge include color consistency, odor amount, and associated symptoms. The color can be clear white or slightly off-white. The consistency ranges from watery to creamy or slightly thick, depending on the menstrual cycle phase. The odor is mild or odorless. The amount varies depending on hormonal levels, sexual activity, pregnancy, or birth control use. Importantly, normal discharge should not be accompanied by itching, burning pain, or a foul odor. Menstrual phase, which spans days 1 through 5, features minimal to no discharge with the presence of blood. During the follicular phase, from days 6 to 14, the discharge becomes watery and clear as estrogen levels rise. The ovulatory phase, occurring between days 14 and 16, sees egg-white, stretchy cervical mucus to facilitate sperm movement. In the luteal phase, from days 17 to 28, the discharge becomes thick, creamy, and white or yellowish due to an increase in progesterone. Cervical mucus is specifically secreted by the cervical glands and changes in response to estrogen and progesterone. It plays a key role in fertility by either facilitating or preventing sperm movement. Cervical mucus is specifically secreted by the cervical glands and changes in response to estrogen and progesterone. It plays a key role in fertility by either facilitating or preventing sperm movement. Dry or scanty mucus is observed during the postmenstrual phase. This is due to low estrogen levels, resulting in minimal mucus production. In the early follicular phase, the mucus becomes sticky. It's thick and non-stretchy, indicating non-fertile days. As we move into the mid-follicular phase, the mucus turns creamy. It's white or milky and increases in amount as ovulation approaches. During the ovulatory phase, the mucus resembles egg whites. It's clear, stretchy, and slippery, providing an ideal environment for sperm survival. Finally, in the post-ovulation or luteal phase, the mucus becomes thick and sticky again. This is due to progesterone dominance, forming a protective barrier. Abnormal discharge can be a sign of infections. It's crucial to pay attention to any changes in color, consistency, odor, or associated symptoms. These can indicate bacterial or yeast infections, sexually transmitted infections, or other health issues that need medical attention. Any deviation from the normal discharge in terms of color, consistency, odor, or associated symptoms can indicate an infection, hormonal imbalance, or other pathology. It's essential to recognize these changes early and seek medical advice for proper diagnosis and treatment. Bacterial vaginosis, often referred to as BV, presents with a thin, gray or white discharge that has a fishy odor. Symptoms include itching, burning, and it tends to worsen after intercourse. This condition is caused by an overgrowth of Gardnerella vaginalis, which disrupts the normal vaginal flora. Yeast infection, also known as candidiasis, is characterized by a thick white discharge that resembles cottage cheese and typically has no strong odor. It can cause intense itching, burning, redness, and swelling. This infection is due to an overgrowth of Candida albicans, which can be triggered by factors such as antibiotics, diabetes, or hormonal imbalances. Trichomoniasis is distinguished by a frothy, yellow-green discharge with a strong, foul odor. It often leads to painful urination, itching, and inflammation. This infection is caused by Trichomonas vaginalis, a sexually transmitted disease. Chlamydia, mucopurulent, yellow increased discharge, often asymptomatic, may cause pelvic pain. Chlamydia trachomatis, a sexually transmitted disease. Gonorrhea, yellow-green, mucopurulent, thick. Pelvic pain, painful urination, spotting. Neisseria gonorrhoeae, also a sexually transmitted disease. Pelvic inflammatory disease, or PID, heavy, foul-smelling, pus-like discharge. Fever, pelvic pain, painful intercourse, often a result of untreated sexually transmitted diseases like chlamydia and gonorrhea. Now, let's talk about abnormal discharge that isn't caused by infections. This can include hormonal imbalances, foreign bodies, or even certain medical conditions. It's important to recognize these causes to ensure proper treatment and care. Hormonal imbalance, increased clear or milky discharge, irregular cycles, PMS, acne, PCOS, thyroid disorders, perimenopause. Cervical ectropion, increased watery or mucus discharge. Postcoital spotting, mild irritation, estrogen dominance, pregnancy, OCP use. Allergic reactions, increased watery or thick discharge. Itching, redness, irritation, soaps, lubricants, spermicides. Foreign body, such as a tampon, can cause foul-smelling, brownish, pus-like discharge. You might also experience pain, spotting, and possibly a fever. This can happen with a retained tampon, condom, or other object. Cervical or vaginal cancer can present with watery, pink, or bloody discharge. Look out for postmenopausal bleeding and pain. HPV infection and an abnormal pap smear are often associated with these cancers. Seek medical evaluation if you experience a sudden change in color, consistency, or odor. Itching, burning, pain, or swelling in the vaginal area are also signs. Foul-smelling discharge resembling rotten fish or sulfur, pelvic pain, fever, or discomfort during sex should not be ignored. Additionally, bleeding between periods or postmenopausal spotting warrants a visit to your healthcare provider. Normal vaginal discharge and cervical mucus are essential for reproductive and vaginal health. Understanding their variations helps distinguish normal from abnormal secretions. Any abnormal discharge should prompt medical evaluation, especially when associated with odor, pain, or unusual coloration.